PHA3021 CVS exercise by Benjamin
and Melissa.
The characters in our story consist of the mugger, the doctor,
the other doctor, and the old lady.
Our story starts in a town far, far away, in a small home owned by a little old lady.
A new morning. Time for breakfast.
The old lady then makes her way to the fridge, and she slowly opens the fridge. To her surprise, the fridge was empty, and hence she thought,
Must go to the shop. I'm too anxious to go to the store. So many things can happen. I'm going to take my drug.
So she walks over to the counter and she takes phenobarbiturate.
I feel so much better taking that drug. La la la, going to the shops.
Stop right there! Give me your purse! The thief ran away after accomplishing what he wanted to do. The old lady suddenly felt her body go numb. She tried to scream for help, but couldn't do so. Her vision started to blur and she felt dizzy. At the same time, a passerby walked by, and he had been trained in first aid and the care for elderly. The passerby used a diagnostic tool called FAST to check what was going on with her, as he had seen strokes before. He checked for her facial weakness, whether she was able to smile, and whether there was a droop on one side, which there was. He tested for her arm weaknesses, where he lifted up both her arms and asked her to hold them still and then dropped them. He tried speaking to her, and he couldn't understand a word she was saying. And he called the ambulance as soon as he could. A day later, there are two types of main strokes, isomeric and hemorrhagic, and two subgroups each, embolic, thrombotic, and subanechoic and intercerebral respectively.
Yes, and both groups differ from how they work. Ischemic is due to particles blocking blood flow, and hemorrhagic is the rupture of blood vessels. In her case, it is most likely ischemic due to her family records. MRI also shows this.
You're right, the MRI shows a blockage in the brain. Nurse, give her heparin.
We are all out of heparin, sir. He spent all the hospital money at the clubs, so we can't restock.
Then what do we have then?
Warfarin?
Fine, Warfarin it is, put it in. So, do you know how the coagulation pathway works?
Yes. Coagulation occurs when the intrinsic pathway amplifies factor 10 activation. In addition to direct activation of factor 10, the tissue factor factor 7A complex also activates factor 9. Factor 9A together with its cofactor factor 8A then activates factor 10 to generate additional factor 10A. Both of these pathways converge at the final common pathway. Factor 10A together with its cofactor, factor 5A, forms prothrombinase, a complex that efficiently activates prothrombin, also known as factor 2, to generate thrombin, also known as factor 2A.
That's right. Thrombin converts fibrinogen, a soluble protein, into fibrin monomers that polymerize to form fibrin strands. Warfarin is also a vitamin K antagonist. Hence, it targets multiple vitamin K dependent factors, reducing fibrin production by disrupting the coagulant cascade. So do you know how it works in vitamin K cycle?
In the vitamin K cycle, warfarin interacts with the KO reductase enzyme so that vitamin K cannot be recycled back to vitamin K. This leads to a depletion of vitamin KH2, thereby limiting the carboxylase of several glutamate residues in prothrombin, also known as factor 2, affecting the synthesis of factors 7, 2, 9, and 10, as well as the endogenous anticoagulants proteins C and S. The blockade results in decreased thrombin levels and a decrease in the amount of thrombin generated and bound to fibrin. This reduces the thrombogenicity of clots.
In conclusion, vitamin K is antagonized by warfarin.
But the reaction is so slow. Do you know why this is?
Well, from her blood test, we found a drug called phenobarbiturate, and it reacts with warfarin. How it reacts is acting on the same enzyme known as CYP2C9. However, if we had used a different kind of warfarin, such as our warfarin, we would not have seen this change. This barbital induces the enzyme and makes it stronger. This is similar to the case of ultra-metabolizers of drugs. This will cause the drug to be metabolized faster and hence causing a lesser effect to be seen. To counter this, we should just increase the dose for a higher effect. For future reference, patients on warfarins will have to go through weekly blood tests to ensure that dosage is most appropriate. The therapeutic range for oral anticoagulant therapy is defined in terms of an international normalized ratio, INR. So warfarin takes 2 to 5 days to have its full effects. So if you're trying to judge impact on the changing dose, you'll need to wait around 2 to 3 days and measure the INR. So it is better to give the starting patient a baseline INR rather than a large loading dose. So do you know what's INR?
I know that INR is the name of a test to measure how thin or thick your blood is.
That's right. The more warfarin you are given, the more INR will go. The less warfarin, the lower it will go. If the INR is too low, then you're at risk of getting clots, and high is cough bleeding. So it's important to know the appropriate range. So what are the adverse effects of warfarins?
I know that bleeding can occur due to the thinning of blood, so I should ask patients whether they have experienced any unusual bleeds such as nosebleeds, urine is red or pink, bloody stools, or coughing up blood. Also, patients should not take aspirin or any other drugs over the counter without consultant while on warfarin, because there are many drugs interactions with warfarin. In addition, they should avoid alcohol and not take warfarin when pregnant. Also, decrease the intake of green leafy vegetables because they are high in vitamin K and can cancel out the effect of warfarin. However, it can also be used as treatment for overdose of warfarin.
Not bad. Not bad at all.
So, promotion?
How about no?
Thanks to the awesome knowledge of the two doctors which got them full marks in a CVS exercise while they were studying, the lady was saved and was able to overcome her stroke.
She now lives a healthier lifestyle, will still be dependent on warfarin on preventing another stroke.